order. So go ahead.
Okay, so just to start out here, again, I'm going over patient inquiries and engaging the patient. So just to start out here, we've got a couple different options available at the back of our slides or on the back of our statements that are there for if there's any questions the patient might have in regards to the statement that they had received from one of our practices. So there's a couple different items that we could address that might need to be updated. So the patient might have a balance dispute. Maybe they want to set up a payment plan. Maybe a payment that they had made to one of the practices maybe isn't reflecting in their balance. There could be an insurance info update that needs to be done. Maybe the patient had gotten a new insurance. They could also, if they wanted to sign up for one of our nutrition classes that we have with the United Medical ACO, they could do that. Or if they have any medical record requests that they need forwarded to one of their other providers, it's also an option that's available on our billing.umusa.net website. So in the next slide after that, it's just some of the reasons again for the patient inquiry. We discussed a few of them just a moment ago here. We also have, there could be maybe collection balance inquiries that are there. If they want to pay a bill, if they want to set up a payment plan. Maybe if there's a request from a payer or an attorney, we might receive a patient inquiry or a new statement request. Again, these are some of the items that we would have that we would receive through our patient inquiries. On the next slide here, where would we go? So again, we would go to billing@umusa.net. The patient would be able to put in an inquiry on our website there, and they could select one of those options from the drop-down list that would be available for the reason for the inquiry. And then we would be able to then reach back out to the patient with the resolution to that inquiry. So we do have the option, so patients could either receive a phone call back from us if they had wanted to put the inquiry in for a phone call, or we can do email resolutions, which I like because, you know, that it saves them some time. They don't have to wait by the phone waiting to hear back responses from their inquiry. They could just have the email that would come back to them, letting them know that everything is taken care of.
So now, I think with the COVID, as I always say, there's always some silver lining with some of the crises that we go through. And maybe one of the silver lining is that we were able to actually utilize our online applications and online tools much better than before. And I think everyone is more open to utilize them. Before it was, everyone was, trying to get a phone call or trying to get us while we weren't available, or when we called the patient, they weren't available. So now we were able to actually master the online tools, utilization of the online tools. So I think that's one of the really good outcome of this maybe crisis that we went through.
Yeah, absolutely. As we know, our patients' time is valuable, so we want to make sure that we're providing, an excellent level of care, regardless of the time that it is, so that they don't have to wait on us. We could be able to take care of that for them and get that information back to them. So the slides are, now what we're seeing is just kind of an example of what that inquiry would look like. So that I had a question in regards to my bill, you'd receive a message back letting them know that an inquiry was created. And then once we have the resolution for that inquiry, it would then send another email out, just letting the patient know that we have everything taken care of. So we would let them know, okay, according to that inquiry, it had been resolved. Initially, we had like an example inquiry there for about a bill that they had thought that the bill was covered by the insurance company. Our response back in this instance was that the balance was applied to that patient's yearly deductible. So they would have that information back. And then if there was anything further, we could always, they could always reach back out to us if need be. But that way, at least they didn't have to wait for a call back to be able to get that answer. They could then go about what they needed to do on their day-to-day. So what I had next on that is on our website, we would have there's a couple different places that they click to be able to get to those inquiries, or if they had wanted to make a phone call to us to discuss a bill or so as well.
So just kind of show quickly on our side, I'm going to share my screen. So we can kind of see how easily we are able to reach out to these pages. So
we do have the patients tab for patients, as well as along the bottom there, we have an option that
if I
is for
click here,
patients. Mhm.
all right, here's that click, and then that's the first thing, right?
Yep, it's the first one that's there. So they could select a patient inquiry. And it would take you to right to that inquiry page, so they'd be able to select if they would like to receive an email confirmation, which is what we were discussing there, that we could send them that email back with the response. And then we would be able to select the reason for the inquiry.
So if they were to just do the insurance info update, they really don't need to call.
Yep.
On
The
us.
insurance, sorry.
Go ahead.
Oh, I was just, so the insurance information update is great, because then they can just include their insurance information right on the inquiry itself. So they can include that insurance company, their member ID, group number information, right into the inquiry, so that they don't have to worry about providing that to us over the phone. We'd be able to just get that updated in the system for them and resubmit their claims.
So then, since I clicked the yes, I would like to receive an email confirmation, and I put my email, and this would get me a confirmation with my ID number, right? My reference number.
Yes.
So let's see if I received that. Yeah, I just received it.
So
And yep, this is, I'm going to bring it up to the screen. So United Medical confirmation. So then they have the confirmation ID. So then, as we are doing our updates, then they would actually get an email back with the updates, right? So this would be taken care of, or it's already taken care of, or if we have any additional information, we would be able to reach out to them.
Yep.
All right, so we can
Absolutely.
go back to your slides.
Okay, so so those are the options that we had available. Again, Kemal just pulled up the website, so we do have those couple icons that are available on there to add the patient inquiry in. If a patient is also calling because they had wanted to make a payment, there is an option for them to be able to pay online as well. So you'd be able to click the button to pay online, and it would give you the directory of the different providers in our network, broken up by like the specialty. So if I had wanted to do, let's say I wanted to pay a bill for United Medical Clinic of Delaware, I'd be able to select on primary care, and then I'd be able to pull up their clinic and then pay the bill directly.
Yep.
So moving on to our next topic on it. So we do have the inquiries that are there. Sometimes we may need additional information from the patient in order to satisfy one of their medical claims. So patient engagement is really important. You know, a patient does play an important role in their healthcare that's there. And there are a couple of things that we might need to reach out to them about, because they could only be updated by a patient. So some of the things that we have is the patient selecting a primary care provider, updating or backdating the coordination of benefits for a patient, or eligibility information. So selecting a primary care provider. So we actually did, you actually did a presentation a while back on how to select a primary care physician, and it's on our United Medical YouTube channel. So we do have that available for patients if they need any assistance on how to select a PCP. But there are some plans that a patient may have that might require them to select a PCP at the beginning of the year. This information would be, is usually added to their insurance card. If a patient doesn't select a primary care provider, their claims could be processed as like out of network, or maybe requesting a referral. Only the patient can actually update their primary care provider, so we wouldn't be able to do it for them, but they would just let their insurance company know, okay, I would like United Medical Clinic of Delaware to be listed as my PCP. So they would have that added in, and then those claims would then be good to process. So we'd have that. And then we'd also have coordination of benefits. So who's paying first, who's paying second on that? If a patient has more than one insurance that's listed, the payment order needs to be established with the insurance companies. So again, the doctor's office or our office is unable to update coordination of benefits for a patient. They would just need to let each of their insurances know who'd be paying primary and who'd be paying secondary. Oftentimes, or there's some insurances that are there that will have you update coordination of benefits yearly. Like for instance, we've got Blue Cross Blue Shield in New Jersey, where they'll send out yearly letters having patients update COB. If they don't hear back from the patient, then they'll start denying their medical claims until they hear back from the patient to have that updated.
So that they will receive a statement from us, self-pay statement, so then it would become like a patient responsibility, right?
Yes, it would be a patient responsibility if the COB has not been updated. Because again, we don't have the ability to do that for the patient. They won't accept our assignment of the coordination of benefits. It does have to come from the patient for them to be able to get that updated. And not just updated, but also backdated if there's a older date of service that's there and they have not, or they're not verifying that they are the primary insurance, they think another insurance is primary. The patient might also have to call the insurance to let them know, as of January, Medicare is my primary insurance or Aetna is my primary insurance, and let them know. That way it would be taken care of from that starting point through to today's date. And then the last one we have is in regards to eligibility. So whenever a patient goes to the doctor, they may be asked for their latest insurance information or if any insurance information has changed. It's extremely important that we have the correct insurance information, so that way we know that claims are being sent to the right insurance and so they're processing properly. If it's a patient's responsibility to provide their doctor's office with the most accurate insurance information that's there. We understand that, people move and addresses change or names change and things like that, but that stuff does need to get updated with the doctor's offices so they can send that out so that the insurances can recognize the patient. So let's say your last name has changed. They would, or if my last name had changed, they might not recognize my claim when it's being sent over to the insurance company if it wasn't updated with the office to the new one. So again, if that information is not updated and if we don't have incorrect insurance information that's there, you'd be hearing from maybe our office if we had to send you a letter to update information or if there was patient responsibility for that claim. And that's pretty much what I had.
Well, so consider the patient communication is not only it's important for the billing side, but it's also important for the clinical side. And we are utilizing our QuickBase database to make sure that we maximize the most accurate communication with them. So we use them for our ACO patients when we are trying to reach out to them for their follow-ups with either with PCPs or with their specialists, their blood work, how to sign up for diabetes sessions, and also the other events that we are doing. So we are communicating those with our patients. On the bariatric side, we are also utilizing them as well. So pretty much most of the follow-ups are through these emails that we have from the portal. So I think it's extremely important for our patients to provide us accurate email addresses so that what we know is like when we call them or when they call us, chances are kind of low for them to get us or for us to get them, because when we call some patients from our case conferences, like they're either at work or they're some of them are teachers, so then they're actually teaching during like 8 to 5. So then the only way that you can efficiently communicate with these individuals is if you are utilizing the electronic portals, and hopefully we can actually get more patients sign up for our patient portals, and understanding that this would be more efficient for them.
Yeah, it definitely helps out because we want to make sure that all of our patients have the opportunities we have a lot of benefits with the ACO. There's a lot of opportunities that patients have with like the bariatric webinars that we have, or with when we're doing these, so that they have that all available to them, and they might be missing out if they are not signed up for their email, if they're not signed up to the portal for them to be able to take advantage of what we have to offer there. So.
Yeah, absolutely. Well, thank you so much for joining us today.
Yeah.
So I'm sure we'll have you again in the next couple of months.
Okay. I hope you have a good rest of your day. Thank you.